Hello again, everyone. Thank you all for taking the time to watch this video. We decided not to do a webinar this time around. I figured it'd just be easier for people to be able to watch the video whenever they have the opportunity to, instead of doing a set time. And we wanted to get this out to people as soon as we could. We're going to be discussing a few things, but primarily some screening that we're going to be doing, both start of care and routinely. So I'm going to try to make this as short as I can. Again, just like I did with the webinar, we'll try to keep it around 20 minutes, hopefully less. And as always, please write your questions down, take some notes, and K-mail them to me. Questions, concerns, recommendations, you can send them in a K-mail. You can text me, you can call me, whatever you'd like. I'm more than happy to talk to everyone about any questions, concerns, or recommendations they may have. So let's dive right in. A brief overview. We're going to be discussing what we've been hearing from our referral sources in the hospitals and things like that. We're going to be discussing what we could be doing with our patients at home to play our part, to be helpful to hospital systems and the general public. And then these two here, most importantly, our new pre-start of care COVID-19 screening tool and our routine COVID-19 screening tool, and as well as some extra staff precautions. Been talking to a lot of different staff members. They've had some recommendations. Thank you to those staff members who have helped me out with that. And of course, thanks to Inga for helping out with that as well. Some reminders and some updates, and let's go ahead and dive into that first one as far as what we're hearing from hospitals and case managers and things like that. And obviously, some of you know my mom is a neurosurgery PA at St. Joe's in Pontiac, so she's been giving us some updates as well. Testing availability is improving. It's still not great, but it is improving. And we're hoping, obviously, that that will improve as time goes on. I think I mentioned it before. That's really the biggest factor to all this. It's the X factor, as they say. If we could do more testing, we could have a better control of this situation. And as we see the number of confirmed cases rise, it's actually a good thing because it means more people are being tested. Because we know there's a lot out there. We know that the numbers are not accurate. We know that there are a lot of people that have not been tested that either have had the virus or do have the virus. But testing availability is improving. The great thing is the testing times are improving. It was like 2 to 5 days, I believe, and now I believe people are getting same-day results. One thing that that's kind of I think reassuring to a lot of us is that patients who have a fever are not being discharged from hospitals. So they really are taking precautions to not discharge people back into the public if they're having certain symptoms and specifically fever. Patients whose tests are pending are not being discharged. I want to make sure I let you guys know this. This is not blanket. Different hospital systems are doing things differently, and different hospitals, even within the same system, are doing things differently. But from what we're hearing from the majority of the people we work with, patients whose tests are pending are not being discharged. Let's say it's 35-year-old who really is not high risk for complications. If they have a test pending and they're in the hospital, they are not being discharged. The next thing here, they are conducting screening on everyone that enters the hospital, the patients, the staff. Obviously, a lot of hospitals, I think the majority of the hospitals, if not all of them, are no longer allowing visitors, but there is personnel and stuff that go into hospitals making deliveries, obviously supplies and things like that. And then no more elective cases. A lot of hospitals are opting for this. Elective surgeries, they are not doing any elective surgeries just to have kind of all hands on deck and all the equipment and all the space and rooms available that they may need. So on to our next point here, playing our part in helping our hospitals. This is really important, and I was a bit disappointed in myself that I did not discuss this. I don't think I addressed it clearly enough or at all in the last webinar. We really, really need to help the hospital systems out here in trying to prevent any unnecessary hospitalizations. Of course, the hospitals need to be free and clear to be able to deal with this, this emergency, this coronavirus emergency. So let's do everything we can to prevent unnecessary hospitalizations. Obviously, if a patient should be going to the hospital, if it's an emergency, of course we want them going. But if we can prevent unnecessary hospitalizations, we should be doing that. And let's talk to our patients about unnecessary hospitalizations or ER visits. Uh, Again, the key to everything as far as mitigating the spread of this virus and containing it and slowing it down is the hospital systems not being overrun. Obviously, they're busy enough as it is dealing with this, coronavirus issue. So if we can do anything to help our patients understand what constitutes a necessary and unnecessary visit to the ER, to the hospital, let's please do that. Obviously, elective surgeries, if your patients have been discussing any upcoming surgeries that are elective at a hospital that's allowing for elective surgeries, please talk to them about that and tell them to think twice before they choose to have a surgery that can be put on hold. Again, I think the majority of the hospitals, I don't know if all of them, but the majority of them are canceling elective surgeries. And then, of course, education. We've talked about it many times. Educate your staff about what's going on. If you need help with anything, I think I was pretty clear in that first informational piece that I sent out to people and that I included in a K-mail to people. Please educate your staff. Please educate your patients on what's going on and how how they can be helpful in trying to contain and minimize the spread of this virus. So moving on to our couple big points here. We are implementing this as of now, um, pre-admission or pre-start of care COVID-19 screening. And basically what this is going to entail is all new patients must be screened prior to entering their home. Now, obviously, as far as we know, the hospital is doing all necessary screening, but that doesn't mean that things can change overnight. And things changing overnight is a reason that we want these screenings to be done on the day of the start of care visit. So, again, if you contact a patient on a Tuesday, you set up a start of care for a Wednesday, let them know that you're going to be calling them the following day prior to the visit to conduct this screening. And of course, we want to instruct them that we're doing this as an extra added precaution. We want to ensure their health, their safety, our staff's health, our staff safety, and of course, our other patients. And again, instruct them that we'll be calling them prior to their visit. And I think if you can try to set a time with them, that would be great. But just let them know, be available, because I will be calling you before the visit. I know a lot of you already do this before both routine and start of care visits, but just let's make sure that they understand what we're doing, and let them know if we're unable to reach them or to conduct a screening, we're going to have to postpone that visit. Now, we are going to tell you guys screening can be done when you arrive, but we do not want you going into the patient's home until that screening is complete. So if you get to a patient's home, you knock on the door, you can tell them, hey, I'm going to call you, please answer your phone so I can conduct this screening before I come in, for an example. Or if you want to conduct it from a safe distance behind a screen door, whatever it may be, if they live in an apartment building, take the necessary precautions, to go ahead and do that screening from a safe distance, 3 to 6 feet. Screening is going to be available online and in a hard copy form. It must be submitted for every new admission that we have. I'm recommending, we would love it if you guys would do it online. You can have the hard copy with you and mark the answers as they're given and then submit it online. I think it's just easier for everybody. You can actually access this on your phones. I'm going to be sending out a link to these forms online that you can fill out, and I'll give you guys a brief example of what that looks like here. So this is what the pre-start of care COVID-19 screening looks like online. I'm not going to go through it all, but it's more questions than the CDC is asking. but it's not going to take all that long. It should take a minute, maybe a minute and a half. It's really not going to be too intensive or anything. And then the main point here is um, if you conduct this screening and you see anything out of the ordinary, or if they're answering yes to a couple questions or more, you should be notifying us immediately. Don't go into the patient's home. Let us know, and we will uh, take a look at the situation together and decide what's the best practice here. Moving along, our routine COVID-19 screening. And again, I want to remind everybody that this is just for the time being. Obviously, we're not, once this situation is under control, hopefully sooner rather than later, we won't be doing these things, obviously. But for now, this is what we are going to be requiring. So effective immediately, we are going to be requiring all of our staff to contact our patients on the day of a scheduled visit. So this is outside of the start of care. Obviously, we're doing this for start of cares, but this is going to be for every follow-up visit for all staff. So on the day of a scheduled visit, we want to be doing this screening, so we can effectively and routinely screen these patients. And again, this is going to be available in online and in a hard copy form, but it does not need to be submitted to us. So this does not need to be turned in, but we are requiring that it's done prior to every visit. And this is what the routine visit screening looks like. Again, I'm not going to go through it all, but a lot of it deals with, if you see, since our last visit, have you had symptoms? Have you had a fever? So that's going to be very helpful in us not putting ourselves into an unnecessary situation, or a situation where we have a patient exhibiting symptoms and we find out when we get there. So if you're a nurse and you see a patient on Thursday and your next visit with them is on Wednesday of the following week, a lot can happen. And of course, we want our patients understanding that they should be contacting us immediately, as their doctors first and then us if they're experiencing symptoms. We do not want them waiting, saying, "Oh, I woke up with a cough today, but the nurse is coming, so I'll just go ahead and wait for her to evaluate me." Obviously, that's not what we want happening. That's what we are trying to avoid here with this routine screening. And again, I know a lot of you already call your patients before their visits, on the day of their visits, when you're on your way there, etc. So please use this tool. Again, it's going to be available in a hard copy form. It's going to be available online. You can access it from your phones as well. It does not need to be submitted to us. As far as a hard copy form, you see a submit button there, but this is not required to be submitted. So moving along, please discuss the following things with your patients before you begin these routine screenings. We want to make sure our patients understand, as it's an extra added precaution, that we'll be conducting routine COVID-19 screenings with all patients. So we don't want to make sure that nobody's feeling singled out. Routine screening is being conducted to protect you, our staff, and our patients. We want to make sure that they know, again, if they begin to experience any coronavirus related symptoms, cough, shortness of breath, fever, that are unrelated to any existing conditions, to contact their physicians immediately and to notify the agency staff prior to having staff or anyone around them or in their home. This is a big part of it. Obviously, we want to protect ourselves, but we have to make sure we're communicating to our patients how they can be protecting not only themselves, but others as well. The next thing here, this is very important. If a patient is able to wash their hands prior to every visit, of course, using the proper hand washing techniques as instructed by the agency staff, we really need them doing. They should be doing it anyway, obviously, but we really need them doing this, and we should be reminding them of this regularly. Let's make sure they really get it into their heads. Maybe it's a habit that will stick. The next thing, staff will be contacting you prior to every visit to conduct this screening. If the staff cannot reach you to conduct the screening, we will not be able to make the visit. Of course, if we can't reach a patient, a lot of times we don't make the visit anyway, but we need to make sure that patients are understanding this, that they're available, that they know what is expected of them, and that it is just precautionary, of course, and it is short-term, hopefully short-term, but it's just for the time being, I should say. Screening can be done prior to entering your home. but not in your home. So we want to make sure that our patients understand that we cannot enter the home until the screening is done, and make sure that they understand that these screenings only take a minute or two. It's probably going to take 30 seconds, if that, but just make sure it's not going to take a whole lot of time. And then, of course, if they have any questions or concerns about the screening process, encourage them to contact our office. I always say encourage the patients to contact our office in any case if they're having any concerns, questions, issues. A lot of our patients just don't know to contact the office. So make sure that they have our number. It's on the start of care book, the patient handbook, and make sure that they understand that they can contact the office anytime. So moving along, taking extra precautions for you guys. What extra precautions that should you be taking? Been asking a lot of questions, talking to a lot of staff about this, and there are simply things that we don't think about when there's an outbreak like this. So we have come up with some things that we're kind of thinking outside the box here of how a virus could be spread on surfaces and things like that. But of course, first and foremost, if you're sick, you're experiencing any symptoms related to coronavirus, notify us right away. And don't see any patients, of course. The next thing, regularly disinfect your car steering wheel, your door handles, other surfaces that are touched regularly before and after patient visits. This is something that, of course, you just don't think about because it's kind of out of your head. It's part of your normal routine. You get in the car, you open the door, you touch your steering wheel, blah, 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 blah. You're touching your face, whatever. So yeah, disinfect regularly. Steering wheel, door handle, parts of your car that are touched regularly, high traffic areas. Regularly disinfect your bags, your equipment, anything else that is being taken in and out of patients' homes. Do this regularly, daily. The handles of the nursing bags, for example, that kind of stuff. Place bags, equipment, anything else that's being taken in and out of patients' homes on a blue pad. If you guys need blue pads, we have a pretty good supply in the office. Let us know. We're happy to send some out to you guys. But again, this is important. Make sure you're placing your bags on a blue pad that's not making contact with with a floor or a table or counter or whatever. And then also try to do this when you're in your car as well. Have a blue pad in your car and place your bag on that. This is a really, really big one. Avoid touching or using your phone, your tablet, your laptop, etc. when you're in a patient's home. A lot of people, again, don't think about that. It's an everyday thing that we use, but I'm sure a lot of you know phones are just a breeding ground for germs and bacteria and viruses and things like that. So that brings me to the next point there. Regularly clean your phone, your tablet, your laptop, etc. Just Google it. You can find how to clean any individual electronic. Let's say you have an iPhone. Google, how do I disinfect my iPhone properly? You don't want to take a Lysol wipe to your iPhone. That could be damaging to it. You want to avoid doing that, especially if you do it regularly. It could wear down some of the materials on there. Moving along, regularly disinfect any pens that you use, to have consent forms signed or anything else. Again, this is one thing that we don't think about. You take the pen out, patient signs, you throw it back in your bag, maybe put it in a plastic bag, maybe disinfect it regularly, whatever the case may be. But that's something, again, where you just have to think outside the box. If a patient has a blood pressure cuff in their home, use theirs. But make sure to disinfect all parts of the cuff prior to and after you use that blood pressure cuff. And then that way it's staying in the patient's home. You're not using one blood pressure cuff for all your patients. This is, again, a big one. When you're in close proximity, thank you, Amanda, for this one, with a patient, request that they turn their head away from you, for example, when taking a patient's blood pressure. So again, if you're taking a patient's blood pressure, they cough, again, we don't know at this point who could and who could not have the virus, regardless of symptoms. They cough, then what happens? So if you're not doing this already, again, just request that that the patients turn their head away from you when you're taking vitals and things like that, when you're in close proximity to them. Now, when you're conducting teaching, or you don't have to be near a patient, if you're not doing wound care or therapy exercises or whatever it may be, you're just doing teaching, you're just talking, you're asking questions or whatever it may be, try to maintain a distance of minimum 3 feet, preferably 6 feet. And of course, just patients will understand. I think everybody has enough information now to know that, to know what's going on. And I think patients will understand these things. So, of course, avoid touching your face, your eyes, your nose, your ears during a visit, after a visit, before a visit. Just avoid it. And then, of course, the big one, wash your hands before, during, and after each visit. We did just order a bunch more, antibacterial soap. So if anybody needs any of that, let us know. And then moving along, these are some reminders for you guys. And it's have you talk to your patients about the following: what to do if they're experiencing symptoms, if they've reviewed the CDC flyers that the staff has left with them. And I sincerely hope that you guys have been doing that. Uh, we worked really hard on putting all that stuff together. We spent money mailing them out. So please, you guys, I really hope that you're using them and that you are encouraging the patients to read them and encouraging them regularly. Have you talked to your patients about whether or not they understand their risk level? This is very important. Of course, we know certain patients are at a higher risk, and we did include what constitutes higher risk and what to do if you're higher risk. We included that in all the information that we sent out, and it is also in that Google Drive link that I sent out to everybody. You can access all this stuff in a shared folder on Google Drive that I put together. It's in a K-mail. I sent you guys the link. You can access it from anywhere. Um, do they understand what's going on and why? Are they understanding why the states are locking down? Are they understand why they're asking for the social distancing, the isolating, the quarantining? Make sure that they understand. This is a big part of this. This is again, we have a significant role to play in the community with patients in their homes, and we could be helping mitigate the spread of this virus. So make sure that they understand why things are happening. And then, of course, are you discussing social distancing, isolating, quarantining? We discuss this a lot. Make sure that you're discussing these things regularly. You walk in, hey, Mrs. Smith, are you being careful? Are you staying home? Are you practicing social distancing? Patients will understand. They're hearing these things a lot. They're not going to say, oh, well, why are you asking me about that? Patients understand what's happening, I think, at this point. A big one, are they prepared? Are they prepared to be at home for a long period of time? Do they have food? Do they have cleaning products? Things like that. And if you feel a patient is not prepared, of course, assess their situation. Um, if you feel they're not prepared, let us know. And then the last one here, washing their hands, proper hand washing technique. Of course, we want to encourage everybody to do that. Everybody should be doing it. Our patients, our staff, me, anybody. Moving along, we have some updates. We did order more supplies. Like I told you guys before, we do have a decent supply of a decent stock of supplies, I should say, masks and gloves and things like that. But we are ordering more. We have been able to order more of some of this stuff. Obviously, the hospitals, first and foremost, need to have dibs on this stuff, but we are ordering what we can. If you guys need supplies, you know where to find me. You know where to find Reem. We're happy to send stuff out to you guys, drop stuff off, whatever it is. I've been doing that all week. Telehealth, no updates on telehealth yet. I'm going to tell you guys this just because things are the way they are. If you're going in, if you have to go into a patient's home just to do teaching and educating, maybe just do that over the phone when you're at the patient's home, outside the door, in the car, whatever it may be. If you don't have to go in, then don't go in. If you can do things over the phone, do them over the phone. If you can limit the amount of, and really this is what I'm saying, if you can limit the amount of time in a patient's home, try to do that. So if you have to take vitals, go in and take vitals, and if you can conduct the rest of the visit over the phone, I'm fine with it. And I'm going to tell you why. Because of my next point, CMS guidance. Again, CMS has done a terrible job at giving us further guidance, at instructing us, at staying in regular communication with home health, and providing us regular updates as far as what's going on. I really hate to put it that way, but there's no other way to put it. Somebody, has to be accountable, and in my opinion, CMS deserves some accountability as far as this goes. So when I'm telling you guys, if you can conduct majority of visits over the phone, do it. Take your vitals, get out, get on the phone. That's fine. And another thing that my mom had told me about this is, being in a patient's home is a much more controlled environment than it is in the hospital. So we are a little bit safer in patients' homes, but of course we need to ask the pertinent questions. Do they have visitors over often? Encourage them to avoid doing that, especially if people are sick or if they've had, you'll see in the routine screening that one of the questions is, have you been in contact with anybody with a respiratory illness since our last visit? So these kinds of things. But it is a much more controlled environment than the hospital, being in a patient's home. So moving along, do our patients need their help? I touched on this real briefly in a couple slides ago, but assess their living situation. Go in and see what is a patient's home looks like. See, are they prepared to be in their home for an extended period of time? Do they have family support? Do they have support from relatives or friends or caregivers? Make sure that our patients are safe, because this is an unprecedented time, in our lives, and as far as what's happening in the country and in the state and locally, and how things are being handled and being asked to stay home. So our senior community, our patients, not all of them have the resources or the help, or the understanding to know whether or not they're prepared or to be prepared. So again, if you feel our patients are not prepared, or safe to stay at their home for an indefinite period of time, let us know. We'll see what we can do for them. Even down to cleaning supplies, Lysol and things like that. If patient says, well, I want to clean, I want to disinfect, but I don't have anything, I can't afford it, I can't leave the house, let us know. We'll help in any way that we can. Moving along, again, thank you all so much. Thank you for listening to this. I'm a little bit over almost 27 minutes here, so it took a little bit longer than I expected. I'm sorry for that, but I appreciate everybody listening to it. I hope it was informative. I hope that you guys are okay with everything that I've discussed, especially the new screening tools that we're going to be requiring of you guys. Again, these things are for your safety, for your family's safety, our patients, their families, and we want you guys to know that this is the reason that we're doing this, to try to protect you guys and try to protect our patients. So again, thank you all so much. I really, really appreciate you taking the time to listen to this. And again, if you have any questions, any concerns, any recommendations for us, please put in a K-mail, text me, call me. Be happy to discuss it with you. Thank you all so much. Hope you all have a wonderful weekend. Bye-bye.